Good afternoon. My name is Ginger Weber. I'm an advanced practice nursing student from Aurora University, and I'm going to teach you all about wound care. The development of hospital-acquired pressure ulcers is a great concern in healthcare today. Pressure ulcer treatment is costly, and the development of pressure ulcers can be prevented by the use of evidence-based nursing practice. In 2008, the Centers for Medicare and Medicaid Services announced that they will no longer. Our objectives: after completing this course, you will be able to identify 4 different types of wounds, 4 local and systemic factors when evaluating wound healing, verbalize 2 factors to consider when selecting wound care products, verbalize 6 required elements of wound care plans, verbalize 7 components of wound documentation. So a quick review, the stages of wound healing. Hemostasis occurs immediately upon tissue injury. Inflammation. The goal is to eliminate necrotic tissue and control bacteria. The proliferation is the fibroblasts responsible for synthesis of new collagen, granulation, and angiogenesis. In the maturation, wound strengthens scar tissue formation, and this can last up to 2 years. Acute versus chronic wounds. Acute wounds, they heal in an orderly, timely, and durable manner. They don't generally. Pictures of common wounds that you'll see in your practice, going right to left across the top. You'll see a skin tear. You'll generally see that in elderly population that has real frail, thin skin. In the middle is a picture of a diabetic ulcer, generally found on the plantar portion of the feet. On the left is an arterial ulcer. Also, you find those generally on the feet. On the bottom, going left to right, on the left-hand side is a picture of venous stasis ulcers. Generally, these have a lot of exudate on them. In the middle is a surgical wound that has not healed and is still open. And on the right bottom is a pressure ulcer. So surgical wounds, primary intention. Usually when you have surgery, the intention is to close the wound in surgery. So your edges of your wound are approximated and held together by staples or sutures or some sort of skin adhesive. The secondary intention is not to close the area in situations such as bowel perforation or penetrating trauma, perforated appendix, or compartment syndrome. The surgeon will generally leave those wounds open for the healing to happen. Sometimes the surgeon will close the wound with staples or sutures. Skin tears, tears or lacerations of the skin resulting in the separation of the skin layers, can be partial thickness. It separates the epidermis from the dermis. The full thickness goes both the epidermis and the dermis from the underlying structure. Generally, this is a jagged or irregular in shape. Typically, it's from grabbing the like an arm or a leg. Venous stasis ulcers. So a little knowledge check. sites